Hey, this is Christopher again, and I just want to talk today. I'm sorry, I guess, first off, that we're not at the emergency department taking a video, but there will be one next week. We were pretty busy this weekend. But anyway, I want to talk a little bit about why it's important to understand the circulatory system for either patients that are coming to the emergency department or specifically for future healthcare providers who may be working in a healthcare setting, especially in the ER. So we're going to talk a little bit about the ways that we access the circulatory system, why we access it, and what we're looking for. So I want to go through. The first thing is looking at how we get into the capillaries, the veins, the arteries, and finally we're going to talk a little bit about intraosseous. It's actually getting into the bone and the circulatory system into the bone and why we do those things. So first off, let's talk about gaining access to the capillary system. One of the most common things that we do is called point of care testing, and specifically we kind of do that with something where we're checking the patient's blood glucose levels. This can be for anybody that has things like altered mental status. We access that as soon as a person comes into the emergency department that has stroke-like symptoms. More often than not are patients who have diabetes and we need to get a check on their blood sugar. And we do this very frequently if a patient has been admitted up on the floor. For a guy like me who has diabetes, I know every couple of hours they're going to check my blood sugar. And one of the things that we do is we make a quick little nick on the skin, on the pad of one of the fingers, and once the blood comes up to the surface, we use one of the test strips that are found on that point of care testing, and we can get a pretty quick number of their blood glucose. And so that's one of the things that we do in the capillary system, is being able to check point of care testing for blood glucose, is get an accurate level of their blood glucose levels, and that can kind of lead us down the path on treatment. The second thing that we do pretty frequently is gaining access into your veins. Now, it can be just as simple as where we do a venipuncture, is where we go in and draw lab work, for example. But one of the things that we do pretty frequently in the emergency department is to gain access into your veins in order to be able to not only gather that data from the blood, but also to be able to administer medications through the IV route. And so super important for you to understand the location of many of these veins and everything, where they're located at, is because you are going to have to access that, whether you're working as a nurse, a provider, or maybe you're in another field, such as you're an x-ray tech and you're coming in and you're having to gain access in order to give radioactive dye for a CT, for example. So IV access is one of the big things that we do in the emergency department. The only drawback is sometimes IV access, it can be a timely process. It can be a difficult one depending on the patient's anatomy and what's going on with them. Some people have veins that are very difficult to access depending on some of their disease process. And so, but we are going to try to gain IV access. It's the quickest way for us to give medications to relieve that person's symptoms when they are in the emergency department, and also for us to be able to draw blood and different things. We can also get that out of the IV tubing. Now, sometimes a patient may have to have multiple access. All right, let's say we've started an IV, we've got it over here into their right antecubital, and we've got an order for 2 medications, but unfortunately these medications are not compatible, so we can't put them in the same IV line. So one of the things we may have to do is to start another IV in the opposite arm so that we can have both of those medications running at the same time but not in the same area, and so we don't have to worry about them interacting with each other once we give those. And so compatibility is very important when we're giving IV medications, but it is a route that we're going to have to get into. The next thing is gaining access into the arteries. Now, we don't typically give medications into the artery, but one of the things that we do is we do have to go in and draw out arterial blood to get what's known as ABGs, arterial blood gases. And this is really important if we have patients that come in and we either think that they are having respiratory issues, maybe they're anemic and we're having to figure out things, they're septic, and it can give us a lot. It can tell us a lot of information about the pH, what's going on with them metabolically, and it can also tell us a lot about how those gases are working? Is that patient getting enough oxygen? Are they holding on to too much CO2? Are they retaining or gaining bicarb? And so one of the places that we typically try to find this access is right through here. All right, this is where we can go in to the radial artery. All right, this is typically where most of us will get a pulse at, and we can go in with a small little stick, goes into the artery, and we can draw out that blood, and it gives us a really good, accurate count of what's going on with that patient as far as their oxygenation and their status is going on. And that's one of the things that we do. It's called an ABG, or an arterial blood gas. And so we are accessing that patient's circulatory system via the artery, and that's one of the other ways. One of the other locations that we can do, if we can't get it in the wrist, is we can go through the groin, and we can get it arterially on that route, is by going into the femoral artery and gaining that. And a little more painful, but honestly, all of the stuff we're sticking people is kind of painful. The last, and certainly not least, we don't really think about this as being part of that circulatory system, is to go through the bone. All right, you have to think about your bone. It's very spongy on the inside, and it's got a lot of blood flow that goes there, and we can access that. Now, we only reserve this for the most sick patients. All right, the patients who are very emergent, and we're getting access into their circulatory system via the IV route, which is the preferred method, is going to be, it's going to take too much time to try to find access. And this is for patients that, for example, we have a patient who comes in cardiac arrest, which means their heart is stopped, nothing's working. All right, we start pumping on their chest, and one of the medications that we have to give rather quickly is epinephrine. And so epinephrine we can give in the IO route. And so what we do is we have a special device which is known as an Easy IO. It's manufactured by a company. It kind of looks like a little drill. And we put the needle on the drill. We go down into the bone. There's specific sites that we're looking for. And we drill into it. We pull the needle out, and it's giving us a little shaft, so there's a trocar that stays in there. And we can pull out some of the marrow, what gives us a little bit of space to work into in the bone, and we can administer medications that way. There are some drawbacks to that. Number one, if that patient is awake, it's very, very painful. It's a very painful procedure, but most of the time these patients are going to be unresponsive when we're doing this. When we give that route, one of the things that can be a drawback is you have to have an IV pump and be able to put pressure behind it to make it run. If not, you have to put a pressure bag on a bag to get IV. You'd say we're given an IV solution to go into it. So it can be a little bit slower of a route, but it works great when we're having to give emergent medications. Medications such as epinephrine and cardiac arrest, and other antiarrhythmics and different things that we're giving to them. Emergency medications is typically what we go by the IO route. So I hope you learned a little bit of something about how we access the circulatory system in the emergency department. Remember, again, one of the first things is, of course, the capillaries. We typically do that for blood glucose. Venous is whether we're doing a venipuncture to get blood steadies, which we also access the venous system for IV medications. Arterial is when we're doing arterial blood gases, and finally IO is for the emergency administration of fluids or emergent medications. Hope you learned a little bit something today. Look forward to seeing you guys next week and having a video where I'm going to go into the emergency department. I'm actually going to interview one of our providers and talk about some of the ways it's important to understand the lymphatic system. And so look forward to that and getting to meet one of our providers. So I hope you guys enjoy it. Have a great day. And also I will be putting out the video later on today about congestive heart failure, and I hope you enjoy that one as well. Thanks, guys. You have a great day. Bye-bye.